Hi, I get a number of clients who suffer with issues with pins and needles in their fingers, feelings like they have paper cuts on the tips of their fingers, as well as numbness into the wrist, forearm, and a lot of the time it's actually coming from the lat muscle underneath the posterior armpit. So your lat muscle actually, because it runs along the lateral border of your shoulder blade, where the nerves exit and then pass through the bicep and tricep and then into the forearm. Sometimes that space is reduced because of an increase in muscle contraction in the lat dorsi. So it will start at the iliac crest, it attaches to the ribs, it will attach to the bottom part of your shoulder blade, and it will come up and attach to the inside of your humerus on the arm. So when your lat muscles are tight, then you're going to internally rotate your arm, and it will be tight. So when you go into any form of extension, then you may find that if things are tight, that this exercise might help. So if you get the thumb of the opposite hand and push it into like the armpit, and then grab as the flesh of the posterior armpit, and what you're looking for is sections that might feel like a sausage or an egg, and sometimes when you apply pressure to them, they will give symptoms of your pins and needles into your hand. Now, looking to do a small amount of a squeeze, hold for 10 seconds, wait for the pain to drop down, will also assist. So you can work into all of the muscle tissue. What I tend to find is the lower fibers tend to relate more to the fingertips. The area that's closer to the armpit, normally you'll find that the discomfort comes into areas that, like the deltoid muscle. So what you can do is press and hold, and then just do some small pin and stretch movements so that you're flossing the muscle tissue through your fingertips and through the pincer grip. If you do that a few times each day, hopefully the sensation that you've got into your hand, your forearm, will gradually start to reduce, because the space where the nerves pass through and into the arm increases, because the tension in the lat muscle, and also the muscles along that lateral border, so the teres muscles, that again sort of feed into the rotator cuff area. So if you can reduce the tension that you've got in that armpit area, hopefully you might find that the discomfort in your hand reduces as well. So pin, hold, and wait for the discomfort to go down, or pin and stretch and just do a few movements that floss the muscle tissue through your grip. Okay, give it a go, see how you get on. Thank you.